Welcome to a new series at ARTO where we'll be speaking to the people inside ARTO. Here we're trying to provide you with insights from our talent experts. They cover different niche verticals, and so for you as a candidate or a client, we're providing you our insights and also tips in this current market. I'm joined today with Anna-Louise Webb. Anna specialises in our medical affairs rare disease space, focused in North America. Anna, let's start our first question. So how has the demand of medical affairs talent in rare disease evolved in recent years?
I think recently we've definitely seen an uptick in the area. I think the Orphan Drug Act was brought in, I believe it was in the 80s, and since then I think orphan or rare disease drug approvals have kind of multiplied tenfold over the last 30 years, up to about 300 a year at the moment. So that obviously means there's a high demand for talent. I think companies who have the talent already are really trying hard to keep hold of it, which means that the demand is even higher. I think it is really coming through medical affairs now. Naturally, clinical development, ClinOps, R&D, they all kind of see the increase first. And over the next, I think, 8 years, we're going to see it's projected to grow by another 250% in medical affairs as well. So it's the beginning of hopefully a very big wave.
Okay, so really encouraging then. So in terms of skill set demand, where do you see hiring for medical affairs roles in rare disease focused organisations?
I think it's clear and obvious the most valuable thing that you can have in any medical affairs function is experience launching within that space. With rare disease, I think it's even more niche because there are over 9,000 recognised rare diseases. Obviously, not all of those have treatments for as well, and some of them only have one. Many of them are actually first in class that these kind of companies are working to treat as well. So, of course, in that case, they're not going to get that experience. I think when you look at, we're working with a company at the moment who work in Duchenne muscular dystrophy, which is a rare neuromuscular disorder. And there's only 2 other companies who've launched in the space. They have launched already, so they're the 3rd company in the space. There are 6 other companies who are working in the space as well, pre-launch. So when you think you add up the talent that you've got there who have that experience versus the demand for talent there, it's completely through the roof, and there aren't enough people who have that experience. So then you have to weigh up, well, how much do you need that experience, because the companies are paying more to keep their current talent there.
Yeah.
And also, could you just broaden your search or broaden what you're looking for and just take that rare neuromuscular experience instead from other companies? And maybe that is enough on this occasion. Maybe it's finding a balance between the people that you have and the people that you don't have in certain positions already. So I think that's easily the most valuable talent that people have at the moment in the space, and it's how can it be used in other companies and competing companies as well.
With people that I speak with that go into rare diseases, they often don't want to go out. And obviously when we look at other areas and you're looking at companies that want a scope of like a multitude of therapies that they've experienced, how do people transition in? Like, do you see this once you're in rare diseases, you don't want to get out because it's such a unique skill set or area?
I think the good thing about rare diseases is it's quite easy at a junior level to enter in rare diseases, because they can, at that level, they'll take any kind of therapeutic expertise because there's rare in all areas. So that's promising if you want to get into rare diseases. People often don't want to leave rare diseases then because they've seen the direct impact that it has on the patients. And there are such fewer patients. They build real relationships with patient advocacy groups and hospitals treating this. So point they then don't want to kind of branch away from it. It's really rewarding in that sense.
No, I completely agree with that point. In terms of then rare disease and obviously the deep niche expertise it requires, how are you finding companies identifying and then nurturing that talent with such niche knowledge?
I think there are a few companies out there who are doing a really good job and being really clever about how they do it. Many of them, because they know that how hard some of this talent is to find. If they know that they've got this hire coming up in kind of 6 months, a year's time, they actually might hire it early when that talent becomes available because it is so niche. So there's a real kind of balancing act between kind of right time and right person, right talent. Of course, there's always a risk associated with it, and it could be an expensive risk, but it's also expensive if you hire wrong, you hire in a rush when you get to your 6 months, 12 months deadline. So there's that risk associated with it. I think nurturing in this kind of, I think there's been a generational shift. People are kind of moving away from hiring based on, or staying within a company based on what they get at the company, on money, incentives, training. Yes, that's important, but people will leave a company based on culture, even if they're paid above all odds. People will leave based on culture. So I think culture is an important element to consider, both from a hiring perspective and from if you're the employee. When you interview, definitely make sure you're asking all about the culture. Speak to as many people as you can about the culture, because everybody values culture differently. And in these smaller organisations, which many rare disease companies are, if there's a bad culture, then it's a really bad place to work. If there's one bad egg in a big company, it often gets diluted. I think that's being more recognised by hiring managers as well. And recently I actually had a hiring manager say, we will hire over a cultural fit more than experience, which I think it's the first time I've ever had that. So I think that just proves how important culture is now. I know it's hard as a hiring manager when you've already got a team to build a culture, when there's already a culture there. But I think if you just have that forefront of your mind and you pay competitively and improve them in education and training, then you should maintain your talent in a really competitive market.
You made a point earlier about companies having to proactively sort of guesstimate or think 6 months in advance as the talent they're going to need. Compared in our industry, obviously, we're very reactive. So when we're struggling to hire, and then they'll ring us up and say, look, we've been looking for X amount of period. Can you then try and find someone? Have you had to adapt or adopt new models in terms of that proactive approach with some of the clients you've had in terms of we might need someone in the next period?
Yeah, definitely. I think 75% of what we do is networking with candidates who aren't looking for a new job, but we know that they're outstanding candidates with really niche knowledge, and we know at some point those candidates will be looking for a job. So it's about helping kind of building a relationship with them, so when they are ready to start thinking kind of a bit more proactively, then we are there to help them with that, to match them with companies of interest. And it might even be that working with them is a 6-month process to find a company that matches them. And it's a bit of give and take, and that timing needs to align to a certain extent, but there always needs to be a bit flexibility on both client side and candidate side to end up with the best candidate at the right time. And to add to that, I think we're seeing a high demand for clients coming to us and asking us to kind of do some talent mapping for them, where we're kind of looking into the market, their specialist area, their competitors, speaking with the people at those companies and kind of trying to gauge at what point they might be interested in a move. So we can kind of give them a heads up and they can plan for it and kind of take it into account a little bit more going into their year plans and even their 18-month plans.
Nice. Obviously, a really good area that we're seeing a lot of demand in. So then sticking with obviously your area, then how are the smaller biotech firms competing with big pharma to attract this high caliber medical affairs talent?
I think just off the back of that, I think they're just being a bit more mindful. Biotechs traditionally have a bit more fluidity to how they do things. They're less process driven, work within their boxes like they are at big pharma. And obviously this is paying off because the 10 fastest growing rare disease firms last year, none of them were big pharma companies. So the biggest was BridgeBio with 167% increase. Ionis 108% increase, and Recordati rare diseases by 81% increase. But they're obviously doing something really well. I think back to the whole cultural aspect as well, they've got more autonomy over that. They can influence it more because they're typically smaller companies. So I think people are making moves because of that. Interestingly, the big pharma companies that work in rare diseases, at least, well, BMS, Janssen, Takeda and Ipsen all saw at least 30% layoffs last year, or people leaving. So it's lots of people are moving from those big companies to those smaller companies. So they're obviously doing something right.
It's so interesting, I think, the dynamic between people now figuring out where their career is best suited, especially that culture fit you said earlier.
Yeah.
So then, no, it's interesting, obviously, and surprising at certain levels. In terms of then, we all know the market at the moment is a candidate-driven market. What can candidates do, or what advice would you give to candidates and clients do to make sure they are still successful in this challenging period?
It is a really challenging market for candidates. I speak to candidates all the time who've been searching for over a year even, but the reassuring thing about that is what I've seen speaking with these people over the last kind of 2-3 months. More and more of those people are now having interviews, so there's definitely some movement in the market. I spoke to a candidate last week who had 3 job offers from a rare disease company, which I haven't heard of in a good few months. So there are some really positive signs that I think candidates need to bear in mind. If they're getting interviews, that's a good step. That's better than we were where we were at a few months ago. I think my one bit of advice to candidates in this market would be utilize your network. I think people don't do that enough. Sometimes there's a bit of shame associated with the fact that you're still looking for a job after however long. But I think everybody cares about each other. So lean on that a bit more. If you can get a warm intro with a company that you're interested in because you know somebody there or you worked with them before, why would you not use that relationship? And on client side, I think it's really easy to look at a job that you're hiring for, an ad that you've put on LinkedIn, and you've had over 100 applicants and think, oh, amazing. This is the perfect kind of market to be hiring in. And it is good because there are so many candidates out there, but there are also risks with looking at that number and thinking, oh, we've got so many people to choose from here, because it's time. It takes however many hours to go through 100 applications. after 100 applications as well. Usually HR, talent acq, or LinkedIn automatically pull that job down. That sometimes, those 100 applicants can sometimes be taken in 2 days. The passive good candidates aren't applying for LinkedIn adverts, jobs. They're not even looking. They might see something as they scroll past and think, wow, that's really relevant to what I want to do. I'll apply. But it definitely won't be within the first 2 days. So my advice to hiring managers, HR, talent acquisition, probably just be a bit more patient. Accept that you're going to get a lot of applicants. 90% of them probably won't be relevant. I had an accountant apply for one the other day. Crazy. And so I think just bear that in mind, that there are candidates out there, but there may be better candidates out there, and not just to pick a few from that 100, go through all of them properly. There may be one there, but if not, reopen it. Go back to the drawing board.
Thanks, Anna. Really appreciate your insights in this space. I hope people have got a lot of value from this. Look, if the statistics are coming out that there's going to be a lot of increase, fingers crossed that the rare disease space is really going to see some significant growth. And don't forget to follow our LinkedIn page for more videos like this in different areas.